Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. So here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I have the very great pleasure of welcoming Favor Mitchelle Madugugwu out of Nigeria. We're going to call her Favor today. And Favor is a fourth-year student nurse. She has interests in media and communications, social impact. She has a public passion for public health and storytelling. She's an award-winning essayist, and she's a content creator. So welcome, 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 Favor.
Thank you, Madam Dear.
I'm happy that you agreed to do this. I really appreciate it. But you tell me that nursing was not your first choice. So, what made you, even though it was not your first choice, what made you go there?
Okay, I guess it's time to tell a bit of story.
Okay.
Okay, there's something done in Nigeria where I stay. So most times after secondary school, that is the senior secondary school, what most people refer to as high school. So there are a number of exams you are expected to write that would put you in place for going into the higher institution. So one of them is the UTME. That is the Unified Tertiary Matriculation Examination. So for that exam, I wrote it and I did really well. So the total score one can get is always over 400. I had 306 over 400, right? So what I had in mind then was that I wanted to study medicine and surgery. I wanted to become a medical doctor. So after I wrote that exam, there's still one more exam I'm expected to write. So that is like the exam or the screening exam of the school I want to go to. So the school I wanted to go to, or the school I've always wanted to go to, is the University of Ibadan, where I'm currently studying, right? So I sat for the exam and I wrote it, and if I can remember correctly, I think I had 71 or 72 over 100. That one was over 100. And so after they did the whole aggregate thing with the UTME exam and then their own screening exam, I was a bit away from the cutoff that was placed for me. So it was from there when I saw my score, I was like, oh my God, I didn't meet up for medicine and surgery and all of that. So my parents and I were still trying to know what is the way forward. Do I put in for another UTME exam and apply for another school, or still apply for the University of Ibadan? So it was from there, while we were still trying to figure out things and all of that. And one of my friends I met at a tutorial, so most times before we write these exams, we do go for tutorials to prepare for these exams.
Yeah.
So I made a particular friend who wanted to study nursing at the University of Ibadan. She knew what she wanted. So she went for it. She wrote the screening exam for the University of Ibadan, and she made it. She got her admission to study nursing. So she just called me one evening like that. Actually, for my school, the University of Ibadan, it is known for not offering students who don't meet up with the cutoff for the course they want. It is known for not offering students any other course, no option. Once you don't get it, you don't get it. So she just called me that evening and she was like, Favor, check your portal, check your admission portal and all of that. And I checked. I was offered nursing. And it was like a crossroads for me. My parents were already okay, you would have to sit for another exams. Okay, maybe we might try a private institution this time, because University of Ibadan is like a federal university, a federal institution. So that was what we were thinking about, and then nursing came. I was so confused. My parents too were like, what do we do? But then my mom she told me that, people, you know what, just pick nursing. And for myself at that time, I really wanted to leave home. Like, you know, that pressure, your course mates, like your schoolmates from high school, most of them were already in school, they were in
Yeah.
university, they were posting their pictures. Oh my God, okay, I'm in my first year in school and all of that. So I just wanted to leave home. I just said, okay, fine, let's just take nursing. And that is how I got to study nursing.
So now you're in your fourth year, am I correct?
Yeah, I'm in my fourth year.
Which means you have one more year.
Yes, one more year.
So over those 4 years, what has challenged you?
Okay, I would say my first year was one hell of a year. Like studying a course you never wanted to study. Like I never even saw it in my radar at all. I never saw that I was even going to like go for
Mm,
nursing or something. And even then, I never even knew anything about nursing, like
mhm,
nursing. Everything I knew about was like, okay, there was a course called medical medicine and surgery, and then there's something about like the society in Nigeria. Most parents want their children to
mhm,
study like prestigious courses, and they see medicine and surgery as one of those prestigious courses, right? So
mhm,
courses like nursing most times are not really like they
mhm.
are not really known about. Although now, like the narrative is changing, everybody wants to study nursing so they can like jackpot. I don't know if you know what jackpot is.
No,
Yeah, like, you know what jackpot is, right?
no.
Jackpot is like a Nigerian term for like people who want to leave Nigeria to like, okay, for greener
Mhm,
pasture. So
mhm,
nursing is
mhm.
like one of those courses that they see that
Okay.
they feel they can study to like just leave Nigeria. Okay, maybe to
Mhm,
go to the UK, to the US and all of
mhm.
those things. Right. So nowadays I would say nursing is now like getting a lot of PR because
Yeah.
because it has good potential for that jackpot thing,
Mhm,
right? So apart from that, even in my first year and all of that. So, like I said, it was like one hell of a year for me, right? So my first year was hell because I keep asking myself, what are you doing here? You never wanted to study this course. Are you sure you're going to find satisfaction in it? You know, there's something called midlife crisis, right? For me, I was still a young person. I was still a young person, and it was like as if I was going through midlife crisis. My first year and my second year most especially was that way for me. But there
mhm,
was something that I kind of like held on to. There's this saying that goes that if life throws you lemons, right, make lemonades out of them.
mhm, mhm,
But going. And I had this mindset that, okay, I want to explore. I never knew what nursing was, right? So at least it's hard, right? But just try to open your mind to see what this course can even offer you, right? And then my
mhm,
mom too, each time I talk to my mom, especially my second year, when we got exposed to the clinical aspect of nursing, each time my mom calls, I'm always like, Mommy, I don't know what I'm doing here. Like, so she would always encourage me and all of that. Just try to go, just try to go through it. You'll be fine. And then my pastor back then at home, he would always say something. He's a medical doctor. So he would always say something like, nursing is like you're dealing with lives, right? You cannot afford to like let your emotions to like rule you and then you make mistakes. So those kind of things were the things that like made me on my toes. And then the fact that I know that my parents were spending a lot for me to like they were spending a lot for me to get an
mhm.
education in nursing. So as the first child, I would say I'm responsible enough not to like just let
Mhm.
my emotions like take
Yeah.
a critical part of me like that. Yeah.
Yeah.
I don't know if I
Yeah.
answered your question.
So now, though, I see that you are kind of looking to use this nursing education in a different way, other than bedside. You're clear that you're looking for stuff other than bedside. And I get that. I get that. And one of the things that I would like to say to you about being a nurse is that the world is your oyster. You can use this degree of yours in so many different ways. And so I would have to side with your mother and tell you stick with it because it opens so many doors. It opens so many doors. And it probably will expand your own view of what a nurse is. Um, so I would say stick with it. However, you have other interest. Well, let me ask you. Up until now, before I move on, up until now, is there any particular area that you have of your study that you think that you think maybe I would like to even try that bit? For example, any particular specialty in nursing for all, ortho, labor and delivery. You mentioned public health. What piques your interest? It's been 4 years.
Yeah, it's been 4 years. Yeah, for public health, I would say that I would say how public how public health piqued my interest was when I was in my third year. I would
Mm,
say I started enjoying nursing school a bit, just a
yes,
bit.
yes.
Started from my third year. So, and the reason why I started enjoying nursing school was in my third year, we got introduced to mental health nursing. We also got introduced to community health nursing. So, community health nursing is like by extension public health nursing, right?
Mm-hmm.
So, those two courses really piqued my interest a lot. And to the question of why public health piqued my interest, there's an aspect of public health that has to do with prevention, right? You want to make sure that people don't even get down with this illness and then even present at the clinics or at the hospital. So I find myself like really drawn to that part because it has to do with health education, right? Health
Yes.
promotion. In that part of health education, I'm someone very, very particular about communication, right? I love to communicate with people a lot. So I find that I would I feel that not few actually. I know that my strength lies in that area, right? Communication. Let me say the intersection between communication and health education. You can only do health education through communication. And then there are various aspects of communication, the written and then the verbal part. Both of them, I really enjoy both of them a lot.
Mhm.
And even before then, I noticed that I'm this person drawn towards wanting people around me to live healthy, right? Without even visiting the hospital. So those days, I would take it upon myself to go online to like look for certain little health related knowledge that I know I could wrap my head around. I'll
Mhm.
just I'll just go online, make my research about them. And then the small phone I had with me then that my friend got me on my WhatsApp status, then I'll just put little things about certain health concerns and matters. For example, why taking water, why being hydrated, it's like very important for your health and those kind of things. So me getting to my third year and me getting to meet community health nursing, public health nursing, it was just like, okay, I have found something I really love here. Yeah, so I actually look forward to working with, I know dreams come true, right? And he said we should do have big dreams, right?
Yes.
So I have a big dream of working with the World Health Organization and maybe the UNICEF too, right? To like champion health education, health promotion. I mean, people do not have to get sick, right? They do not have to get sick and present at the clinics or hospital. We can educate them well enough. We can help them with health promotion so they can take the responsibility for like being healthy, right? And all of those things.
Awesome, awesome, awesome. And as you said, your dreams are big but necessary. Those are big but necessary dreams. So great. So I'm going to shift just a little bit because I see you are trying to create something called the Mitchell Media Hub.
Yeah.
What is your vision for that? What is that about? What is your vision for it?
For Mitchelle Media Hub, in my second year in nursing school, another thing that has helped me like that has helped me scale through nursing school, even though I never wanted to study nursing, was putting my head outside of nursing school, engaging in extracurricular activities. I volunteer with organizations on campus. I do so many things, right? I attend events, like events that are not related to nursing at all. So it was
Mm,
more of like an escape route for me, right? So those are the things that helped me like maintain my cool while in nursing school. So in my second year, I contested for the office of the public relations officer in my department. Then we are now in faculty though, but we're then a department, and then I won. So from there, I put to use my writing skill. You know, as the PRO, you are in charge of
mm,
disseminating information, managing the social media pages of the organization and all of those things, creating broadcast messages that would make students like do what you want them to do, like as the executive
mhm.
arm and all of those things. So it was from there my interest in media and communications like blossomed, right? So from there, I also kept on in upskilling myself. You know, just anything that just has to do with media and communication just piques my interest a lot. From there, I noticed that I could do real good voiceovers, right? So part of the things Mitchelle Media, or part of the services Mitchelle Media Hub provides, it's voiceover artistry, the content writing aspect, and then the event comparing or event hosting. So those are the three things that Mitchell Media Hub is all about for now. But then I look forward to growing more and everything in between.
Okay, 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 okay. And I think those things marry very well. Communication and and nursing marry very well.
Thank
So
you.
I'm listening to you speak, and I'm thinking, if I were to meet Favor in 10 years, who would she be? What do you think?
Hmm. In 10 years' time, oh, I see myself pursuing my area of interest in public health, right? I see myself pursuing my area of interest in public health, and probably in 10 years' time, I should have a master's in public health, right? And from there, I also believe and I hope that I would have realized my dream of working with the World Health Organization or maybe the UNICEF in
Hmm.
championing health education, health promotion, especially for marginalized
Hmm.
communities and societies.
Okay,
I think
okay.
that's where I see myself.
So I have another question now. As someone who is reluctantly propelled into nursing, what advice do you think you would give someone who said, Favor, I would like to be a nurse? What advice do you have for them?
Hmm. If for someone who was reluctantly propelled
No,
into
I said, as
nursing,
you as someone who was reluctant. So now you were reluctant, you stuck with it, and now you're beginning to see it's beginning to flower for you. So what
yeah.
advice would you give someone else who wants to be a nurse? What would you tell them?
Well, for someone who would want to be a nurse, I would say they should know their why, right? They should know the reason why they want to be a nurse so that even when it gets tough along the line, they can still hold on to it. Because nursing school is a lot, especially in this part of the world,
Mhm.
Nigeria, a lot, right? And then secondly, I would also say that the person has like a growth mindset, right? So you might go into nursing school and then you figure out that maybe bedside nursing is not for you, right? So you just have that growth mindset that you can even still do well even outside of the traditional nursing everyone is used to, right? So just have a growth mindset and I believe the person will be fine.
Okay. All right. That's good advice. what do you do? We talk a lot these days about caring for ourselves, and I see that you do a lot of stuff. So what do you do to care for you?
Okay, to care for myself, oh, I love music. I listen to music each time I'm coming back from lectures, and so many deadlines are ringing in my head. Before you need to do this, you need to prepare for this presentation, you need to prepare for this test, exams are around the corner. And then even right now I'm writing my project, my RN associated project, because I'll be writing my RN exam this November. So
Mhm.
it's like I've never felt this pressure and stress. It looks like each year, as you keep climbing your nursing, you keep climbing each year in your nursing education, um, your nursing education. It seems like it keeps getting harder, right?
Yeah.
Yeah. So for my fourth year, the biggest challenge or the biggest issue I'm having right now on my plate is trying to write my project, right? My project for my RN associated exam. So most times whenever I'm coming back, and then even in between writing this project, trying to write this project, I still have to go for classes, I have
Mhm.
to do presentations, I have to write tests, I have to prepare for exams because my exams for 400 level 4 semester is knocking around the corner already. And then
Mhm.
I have to deal with the pressure of my supervisor as well. Like she wants us to submit chapters 1 to 3 before the end of this week. I mean, this is the weekend is almost finished already. So most times what I do, I'm coming back from classes and it's looking like, oh my God, it seems like the world wants to crash on my head. I listen to music, right? I listen to music. I have friends in other faculties, in other departments that I talk to. Okay, my friend, nursing is already too tough. It's already on my neck, this kind of thing. And then they keep on encouraging me. So like finding solace in talking to friends. And then the third thing I mentioned earlier, that doing extracurricular activities is also
Yeah.
a way. I know it's hard combining everything, but I really find peace. I find joy in doing things I love outside of nursing. So those are the things that help me keep my mental space and keep my mental health in check. Yeah, and then also talking to God too, right? There are times it's like, oh my God, it's a lot, and then I talk to God too.
Mhm. 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 Awesome, awesome. And I'm glad that you are paying attention to that because very often we get swallowed up in the busyness of things and forget that we exist and need to be taken care of.
Yeah.
So very cool, very cool. Favor, thank you so, so very much for this conversation. I've truly enjoyed talking to you. And whether or not well, you're in your fourth year now. I know you're not going to give up now, but you will find your space within this big field of nursing. You will find that space, and I am convinced you'll be great at it listening to you. So thank you so much for speaking to me.
Thank you so much, Madam Thiel. I also enjoyed speaking to you.
All right. Have a truly great one. And I'm looking forward to seeing and hearing about you some more in the future. Okay. I'll be able to say, oh, I know her. Hey, bye bye.
Bye.